today we'll be going over the shoulder and wrist exam. So we'll start off with going over the setup for the shoulder and wrist exam. So prior to the patient's arrival, we will make sure that we set up the zone 4 exam room for them. This includes disinfecting the area, the coils that we will be using, the table, any high touch area. We'll be putting in new sheets on the table and new pillow sheets as well, prepping any padding in advance, um, setting up any of the safety measures that we'll be providing for the patient. Um, Afterwards, once that's all set up, we'll go ahead and gather or retrieve the patient from the waiting area and ask them the several screening questions, as well as confirming and verifying their first and last name, date of birth, and the reason for their exam today. All right. So afterwards, I'll take them to the locker to remove all personal belongings, and changing into a gown or scrub out of their street clothes. And once the exam room set up and we're set up, then we'll go ahead and proceed with the explanation of the exam for the patient and begin. Okay. So the coil that we use for the shoulder is going to be the dedicated shoulder coil. The patient will be positioned head first, supine. The laser landmark is going to be the glenoid fossa, and with the patient's positioning, their hand will be neutral and supinated. Let's see. So going over the angulation and coverage for the shoulder exam. For the axial, we'll want to make sure that it is angled perpendicular to the joint space on the coronal image, and perpendicular to the humerus on the sagittal. The coverage is going to be superior to the acromioclavicular joint into the shaft of the humerus and into the axilla. And the field of view includes all bony anatomy and any adjacent muscles. And so now going over the sagittal. Okay, so for the sagittal, it'll be angled perpendicular with the supraspinatus tendon on the axial image and parallel with the glenohumeral joint on the coronal image. And let's see, the coverage is going to be from the skin to the entire joint space, and just a few slices into the scapula. And the field of view is going to include slightly above the AC joint and into the axilla. All right, and then lastly for the shoulder, the coronal slice, it'll be angled parallel with the supraspinatus tendon on the axial image and parallel with the humerus on the sagittal image. Coverage is going to include the entire bony anatomy and most of the surrounding muscle, and the field of view will include the entire joint and soft tissue of the affected side of the shoulder. All right, and now I'll be going over the wrist. The setup is going to be about the same, so I'll just go into the coil that we'll be using. So for the wrist exam, we'll be using a dedicated wrist coil. However, if it is not available, then we'll go ahead and proceed with using the HD Knee Flex coil, although the wrist coil is preferred. The patient will be positioned head first and prone, so they will be laying on their stomach in the Superman position, so they will be laying with their arm over their head, raised over their head. However, if the patient is unable to do this, then they will just go ahead and lay down head first, supine position on their back with their arms rested to their sides. Even though the Superman position is preferred so that we could avoid less artifacts. Okay. The laser landmark is set at the carpal, and going over the angulation and coverage, we'll start with the axial. So for the wrist exam, It is angled parallel with the carpals and joint space on the coronal image and perpendicular to the metacarpals and joint space on the sagittal. Coverage is from the metacarpals to the radius and the ulna, and the field of view will include the entire soft tissue of the wrist. Sagittal image, it'll be perpendicular to the radius and ulna on the axial image and perpendicular to the joint space in the coronal image. Coverage will be from skin to skin at the wrist joint, and the field of view includes the metacarpals to the radius and the ulna. Coronal image, lastly, will be angled parallel to the radius and ulna and the carpals on the axial and sagittal images. The coverage will be from skin to skin, from the anterior to posterior, and the field of view includes the metacarpals to the radius and ulna. All right, so that will conclude our shoulder and wrist exams. Thank you.